No, we had cost reports and sitting with clients and started having some questions and kind of sat with Dick Connolly, who was our computer guy, and said, Dick, how much would this take to do? And then went to Jack Brose, and Jack kind of said, well, it's not chargeable, but go ahead and see what you guys can do without spending a whole lot of time. So Dick and I worked on it after hours at night and kind of put it together and brought it back to the group and thought there was value in sharing it with clients. That first year we just did it from the clients who had the cost reports that we'd prepared, and so we felt we had to share it with them once we got it completed.
So Mike, we were in a cost reimbursed environment though, so cost comparing didn't matter. What was behind what motivated us to do this? Just interesting information, or was?
No, it was more to bring some value add to clients that other people didn't have, and really to kind of get around that conversation that where were costs? And it was kind of surprising at how varied the costs were. Everybody dealt with the averages. Everybody knew what the averages were, and people would always say, well, they're in the metro region, so they have a higher cost limit, or they were a bigger facility. And so we used those comparisons, and we got such a wide diversion that it really came back to a good tool for them to start with to measure how they could improve, how they could become a higher value add to their customer versus just spending more money. And so as part of that, to be able to align ourselves with where we thought the industry was going to go. And we needed more information to be able to have those conversations. In the past, it didn't matter what you did compared to somebody else because you had no real limits that really affected things. It was really the more you spent, the more you got paid the next year.
I think that might have been the first time we really created what I'd call information exhaust. Information that we had at our disposal from those cost reports. And John, even though it was cost-based at the time, there was a lot of interest in seeing where your costs were compared to others, because you might have found that you're too low in nursing, too high in administration. Right. So you'd see a lot of information that was very helpful to you as you wanted to be more like those that you might have perceived as being successful out there, or looking at averages and at least seeing where you're at.
It was kind of an interesting phenomenon, I thought, and how it had legs very quickly, because we shared it up with clients who we'd use their costs, and we got their permission. And to use it, not knowing what it was going to be, they had a random number so nobody could really see who was, and we had to have enough. And then once that got out into their hands, the conversation, I remember at MAHA at the time on a committee I was on, everybody's talking about it. And it's not us talking about ourselves, it's our clients talking about what we delivered to them, and the folks who weren't our clients really looking at us as the experts because we had something different.
Do you recall there was a division in the Department of Public Welfare at the time, not Department of Human Services. It was called the Long-Term Care Management Division, and they used to publish stats, but people didn't like waiting 2 years, and they looked at our report as being an early look. I remember that clearly, because we didn't have all the facilities in the state, but we had a big number of them, and we were at least a year ahead with our data, and people loved that about it.
Debbie, I'm intrigued by this idea, or reminding us rather, of the conversion to Rule 50, which was a whole different way of receiving reimbursement and then the conversion to case mix. And I recall how mystical that conversion to case mix was initially, because it was hard to get staffing right. It's easy when you have 1 or 2 levels of care, skilled or ICF. It became very challenging with that initial case mix rate, and I seem to remember 11 levels of care. And we came up with this, or benchmarked this idea of standardized nursing hours, where we kind of leveled the playing field. And I think that was part of the computation in the reimbursement model. But I can remember watching all of you, who were much more experienced than I at the time, use that information to reshape how nursing departments were calibrated and staffed.
Well, if you recall, John, the state had a minimum staffing requirement per standardized resident day. So we always made sure that facilities were staffing at least to that minimum. And then we would use those hours per standardized day in relationship to limits to determine how many more hours they could staff or how many more dollars they could spend and remain within the operating rate limits, so they were not spending in excess of the limit.
That's good.
John, they also used the same calculation to see that they were using their spending, especially in nursing or the other care areas, so that if for some reason they became more efficient, your rates would drop. So a lot of people would, I'll say, protect their nursing rate.
We were ahead of our time, weren't we, in developing this information, and we did it almost routinely because it was just I think, Mike, you described it as the right thing to do. We had access to the information. Why wouldn't we publish it? And then we embraced it and shared it with our clients.
We're very operationally focused. Again, knew the clients on a personal basis, and we were very much a tool of theirs to internally look at their operating results, analyze it, see where they were spending the money, see that they're using it, talk about efficiencies, talk about food cost, those sorts of things. It was a much closer relationship to the individual providers. It was also a very cottage industry at that time. There weren't nearly as many consolidated groups.
Remember in the early years, we didn't know whether this was a product that we should charge for or whether it was something that we should just provide. And we struggled with that because it took a lot of time to develop it. Jed, I'm sure you know how much time it takes to develop it, but we really just didn't know what to do even with regard to that. Is this a product that we should sell because it's a value, or should we just give it to people?